Hello and welcome to this Healthcare 101 presentation of what is health insurance. So this is our first module. We'll be very, very basic here. So we'll kind of just start with, why does health insurance exist? Well, health insurance exists to protect you against those major catastrophic risks, financial risks you cannot afford. We all know that medical bills can be some of the most unexpected and expensive things that happen to us in our life. And so health insurance exists to help finance that risk. So who pays for it? A couple things you need to know about who pays for it is usually most employees, most people in America, about 160 plus million Americans get health insurance through their employer. And when it's based on an employer offer, the employer is going to pay a portion of it and you pay the rest of it. This is what comes out of your paycheck. So let's talk about some key terms to know. Premium is the amount that you are paying on a per paycheck basis. This premium is your membership fee to the insurance company. This is coming out of your paycheck pre-tax. This is a tremendous advantage to you as an employed person getting health insurance through your employer, is you're not paying taxes on those premiums. If you get it as an individual, you pay taxes. Deductible. A deductible is, generally speaking, what the insurance company says, you must pay all of this number before we pay any portion. So if you have a $1,000 deductible and you go to the hospital and it's a $3,000 bill, you're going to pay 100% of that first $1,000 and then you start sharing the cost. Copay. A copay is that flat dollar amount you pay for things like doctor visits, prescription drugs, urgent care, physical therapy, maybe some x-rays and blood work. When you go to the doctor, go to a provider, and you pay a flat $30, a flat $25, that is payment in full for that service. Coinsurance. So after you meet your deductible where you paid 100%, then you're going to pay a portion of the cost. This is called co-insurance. Co meaning insurance company pays some, you pay some. All right. So when you hear people talk about a 70-30 plan or an 80-20 plan, they're talking about the percentage split after the deductible that the insurance company pays versus what you pay. So if you had a 30% co-insurance and you met your deductible and had a hospital bill of $10,000 that you're responsible for, you would pay for $3,000. The insurance company pays for $7,000. And the last term is an out-of-pocket maximum. Out-of-pocket maximum, that is the ceiling. Once you spend this number in your health plan, usually somewhere between $3,000 and $8,000, once you spent on copays, doctor visits, emergency room, prescription drugs, everything hits the maximum out-of-pocket cost, you pay nothing else for the remainder of the calendar year. Okay? This is very important, calendar year. Even if your health plan has open enrollment in the middle of the year, July, May, August, whatever it may be, almost all insurance companies have a new start year on January 1st, meaning whatever you pay towards your deductible and your out-of-pocket starts over fresh on January 1st. Very important for you to know this, so that if you find yourself in a situation where you've had a lot of medical expenses and you hit this out-of-pocket maximum, know that for the remaining part of the year, you're not going to be paying a whole lot of out-of-pocket, maybe zero out-of-pocket. So make sure at the end of the year, re-up your prescription drugs, squeeze in those last physical therapy appointments. If you need a follow-up surgery, get it in that year, okay? So those are some of the key terms in the beginning of understanding your health plan. Thanks for tuning in.